Right, today we are going to talk about necrosis. Necrosis is one of the pathway for the cell death. When a cell is irreversibly injured, it goes through the process of necrosis. Before I explain to you, I would love to know what is your concept of necrosis. Yes, what do you think? What is necrosis? So he says it's a process of getting rid of some cells. But the thing is that you can cut my finger and get rid of some cells. Is it a necrotic finger then? No. If you cut my finger, it is dead. But it is not necrotic. Right? For a part to be necrotic, it should remain the part of the living organism. So this definition is not right. What do you think of what is necrosis?
Irreversible cell injury.
Okay, he says necrosis means irreversible cell injury. But the thing is that when there is irreversible cell injury, of course cell undergo death process, but some cells follow apoptotic pathway and other cells follow necrotic pathway. So it means there is a difference in necrosis and apoptosis. Both of them can occur due to irreversible cell injury. Right? So it is not the proper definition. Yes, irreversible cell injury is the cause of necrosis. But what is necrosis? Yes.
Without or without body needs.
Without?
Body needs. With or without body needs. The cell death.
Again you repeat.
So cell death with or without body needs.
Okay, cell death with or without body needs. I think you are telling me a few things which are very new for me. Before I really ask you guys more, I should tell you really what is necrosis. Right? Let me tell you. When a cell is irreversibly damaged, first of all, if cell is going to die, right? Usually it follows one of the two pathways. If a cell is going to die, the cell death normally follows one of the two pathways. Either it goes through the pathway of necrosis or it goes through the pathway of apoptosis. Right? It is called apoptosis. It is also called apoptosis. P is silent. When a cell is going to die, right? Either it goes through necrotic process or it goes through apoptotic process or apoptosis. Is that right? But these are two very different pathways. Necrosis always occurs when there is irreversible cell injury. Right? When there is irreversible cell injury, lethal cell injury and unwanted cell injury, accidental cell injury, pathological cell injury. Necrosis may be due to trauma, maybe due to severe ischemia, maybe due to toxins, maybe due to radiation. So whenever necrosis occurs in your body, it is usually a result of unwanted injury and it always damages the body tissue. Apoptosis, it may be physiological or it may be pathological. Sometimes physiologically we want some cell to be removed from our body. For example, during embryogenesis, right, some cells should disappear. So they disappear by the process of apoptosis. Right? So apoptosis can be physiological or can be pathological. Necrosis is always pathological. Is that right? This is very important. So just saying every cell death is necrosis is not true. Is that right? You must be very clear what is necrosis. And let me tell you what is necrosis. Necrosis is basically a series of morphological changes. What is necrosis? It's a series of morphological changes in a lethally injured cell. In a lethally injured cell. In a lethally or irreversibly injured cells. It means when a cell is so severely damaged, right? If a cell is so severely damaged that it cannot adapt to the injury, it cannot reverse its damage, it cannot adjust with the stress of injury, right? Cell cannot recover due to severe injury or prolonged injury, right? Then certain changes come into a cell. Those changes which come, they take many hours. Those histological changes which appear in a lethally injured cell, those changes take many hours, 4 to 12 hours, to be identified histologically. To be identified, those changes with light microscope. Those series of changes which occur to a lethally injured cell, those changes are called necrosis. Just cell injury is not necrosis. Cell injury may be reversible or it may be irreversible. Cell injury may lead to necrosis or may lead to apoptosis. So what is necrosis? Necrosis is a series of changes occurring in a cell, cytoplasm and nucleus and other organelles, when cell is irreversibly injured. So the whole lecture about concept of necrosis should be that when we are studying necrosis, we have to talk about what are the changes occurring in the cell which has been injured. It means when a cell is lethally injured, just imagine there is a cell here, right? Happy cell, and unfortunately some very severe injury occurs to it, right? Now, after the injury, it will pass through certain changes. It will pass through certain changes, and those changes, right, will eventually lead to the death of cell. These changes are called necrosis, right? These changes are the series of changes which occur in a cell which is lethally injured is called necrosis. Am I clear? Now, let's develop basic concept. Why these changes occur? When a cell is lethally injured, why cell undergoes changes? I will tell those changes in detail. The reason is that when cell is lethally injured, it cannot run its metabolic pathways. It cannot generate its ATP. So whatever ATP or energy currency is present in the cell, that is rapidly utilized. So there is very rapidly energy stores go down. In the injured cell, severely injured cell, energy stores go down. And as you know, just one of the example, as you convert glucose into pyruvic acid, and then normally it enters into Krebs cycle by use of oxygen. If cell cannot run this mechanism, it's so severely injured, pyruvic acid will convert into lactic acid. And if lactic acid accumulates into cell, it will make intracellular environment very acidic. And there will be more biochemical changes as well, not only this. So all these biochemical changes in the severely injured cell or lethally injured cell denature the proteins which are present in the cell. So those protein denaturation start changes into cell. When there is lethal injury, intracellular proteins undergo denaturation, and when those intracellular proteins are undergoing denaturation, right, that will lead to certain changes into cellular structure and function. So what really happens, as I said, these are morphological changes. The important stress is on changes, morphological changes in a lethally injured cell, and these changes are due to, yes, they are due to number one, yes, intracellular proteins denaturation, right? And as you know, the cell has mainly two categories of proteins, two types of proteins. They are structural proteins. When they are denatured, structure of the cell will be disrupted. And there are functional proteins, structural proteins, and there are functional proteins. Functional proteins are enzymes, and there are pumps in the cell, and there are regulatory proteins. They are also denatured, and if these intracellular proteins are denatured, naturally structure and function of the cell is disrupted. Is that right? And this will translate into morphological changes into cell. Is that right? Then, so first thing was lethal injury. irreversible injury, severe injury to the cell, leading to certain morphological changes. Why these morphological changes are occurring? Number one, due to protein denaturation. And secondly, there is enzymatic digestion of such severely injured cells, right? And there is enzymatic digestion of severely injured cell, right? These enzymes which digest the cell, they also bring morphological changes. Is that right? So why the morphological changes are there in the necrotic tissue? Yes. Why the morphological changes are there in necrotic tissue? Number one, due to denaturation of proteins. And number two, due to enzymatic digestion of lethally injured cells. Is that right? Now, enzymatic digestion, why? The reason being that cells, most of the cells have lysosomes, right? And other enzymes, destructive enzymes. And those lysosomes, let's suppose this enzyme has lysosome, lysosomal enzymes are limited within the lysosomal membranes. But when cell is injured, lysosomes may burst. And if lysosomes burst, then what will happen? That these enzymes will come out and start damaging the cellular proteins, right? And if they start digesting the proteins, of course there will be again morphological changes due to proteolysis of cellular component or digestion of cellular components. So this will bring more morphological changes. Now, this digestion of lethally injured cell can occur due to enzymes which are present within the cell, like enzymes of lysosome. If this is going on, such type of digestion of cell by its own enzymes is called autolysis. It is called autolysis. But as we will see, necrotic cells also attract the neutrophils, macrophages and other inflammatory cells. And when these inflammatory cells come to the injured area, these inflammatory cells also release destructive enzymes. Or in necrotic area, there may be pathogenic bacteria. And if those bacteria are there, those bacteria may also release destructive enzymes. And those destructive enzymes, either by the incoming or accumulating neutrophils or by the proliferating microbe, these enzymes from leukocyte sources and microbial sources also do further digestion of the cells. So it means they do further morphological changes into lethally injured cells. Is that right? Yes. So if this type of digestion is going on, right, from those enzymes which are not from the necrotic cell itself, but enzymes which do digestion, and this enzyme digestion, for example, this is a neutrophil, and this is releasing enzyme, or here the microbe, it is also releasing destructive enzyme. Now, this is not autolysis, this is called heterolysis. So, if necrotic cell is undergoing injury, digestion due to its own enzyme, it is autolysis. But if it is going under what? Digestion due to enzyme derived extrinsic to the cell, either from the white blood cells or from the microbes, then we say heterolysis. So what did we learn up to now? That in cells, what is necrosis? It's a series of morphological changes occurring in a lethally injured cell, and these changes are induced by denaturation of intracellular proteins and by enzymatic digestion of lethally injured cells. Am I clear? Yes. Secondly, a very big hallmark of necrosis is that plasma membrane of the cell is disrupted. Plasma membrane of the cell is disrupted. And if plasma membrane of the cell is disrupted, then intracellular constituents come out. Intracellular constituents come out. Cells start bleeding in a way. Of course, there's no blood in the cells. I'm just saying that what really happens when cells are lethally injured, they are unable to maintain the integrity of their plasma membranes. So when plasma membranes become disrupted at multiple levels, intracellular substances come into extracellular area or surrounding interstitium. And intracellular lysosomes are being ruptured. So dangerous compounds come out, dangerous proteolytic enzymes or destructive enzymes are released. So if there are 40 cells which undergo necrosis, and when their cell membranes are disrupted, they are releasing what? Injurious enzymes and intracellular components, and these components, when they leak out, right, intracellular material leak out, it irritate and injure the surrounding cells and surrounding tissue. And you know, whenever a tissue is injured, there is inflammatory reaction. Because remember, necrosis does not occur in one cell. Apoptosis can occur in one cell or very small cluster of cells. Necrosis is usually in a larger group of cells, right? So when a group of cells is undergoing lethal injury, their cell membranes are not maintained well, and from these disrupted cell membranes, a lot of enzymes are coming out, and intracellular components are leaking out, and they injure the surrounding cells and elicit the inflammatory response. The surrounding cells, chemical mediators will be generated at the site, and there will be vasodilatation and increased permeability in microcirculation, and leukocyte will start infiltrating. Why this is happening? Because when inflammatory reaction will occur in the surrounding area, when inflammatory reaction will occur, then white blood cells will come out. They will try to eat the necrotic cells and try to induce the repair. You understand it? Necrotic cells should not stay forever in the body. So our body, how it responds, that whenever a group of cells undergoes necrosis, these cells themselves produce chemical substances which elicit or initiate the inflammatory reaction against around the necrotic zone. And as a part of that inflammatory reaction, blood vessels around that tissue undergo vasodilation, and microcirculation undergo increased permeability. Then proteins, antibodies, and white blood cells, they leak out into necrotic area, and then of course as time passes by, these neutrophils, the macrophages, they will start eating the necrotic cells, and while they are removing the dead cells, they produce the factors which will lead to proliferation of local cells so that tissue can be repaired. Is that right? Or even activate the fibrocyte into fibroblast, and collagenization of scar formation can occur. Am I clear? This is very important to remember. Such inflammatory reaction does not occur in apoptosis. This does not occur around apoptotic cell. This is a classical feature of necrotic cell. Am I clear?
Yes, sir.
Any question up to this? So now we can say that there is more morphological changes occur. Number one, morphological changes occur due to protein denaturation. Secondly, it occurs due to enzymatic digestion. Thirdly, morphological changes into necrotic cells and around its tissue occur due to loss of integrity of plasma membrane of necrotic cells. Right? Membrane rupture at multiple points. Remember, in apoptosis, membrane make blebs but does not rupture. In necrotic cells, cell membranes rupture, and from the ruptured cell membrane, right, the components which come out, they elicit intracellular component leak out, and they elicit, yes, inflammation. Right? So inflammation is also a part of the necrotic reaction, right? So now I will just sum up and then we'll move forward. What is necrosis? Now next time you don't give me funny answers. It's very clear. Necrosis is a series of morphological changes occurring in a lethally injured cell, and these changes are due to, number one, due to intracellular protein denaturation. Number two, these changes are due to enzymatic digestion, and number three, due to disruption of plasma membrane and intracellular component come out and elicit inflammatory reaction. All these changes are the component, all these are happening when a cell, and if many cells, of course in necrosis usually there are many cells, necrotic tissue is undergoing morphological changes. Now, first of all, now as we discussed that necrosis is basically changes occurring in a lethally injured cell. Now these changes don't occur suddenly. These changes which that is denaturation of proteins, enzymatic digestion and inflammatory reaction, these changes take many hours. Depending upon the tissue and depending upon the cause of the injury, these changes take many hours. Usually 4 to 12 hours are required before these changes, necrotic changes, can be manifested under the light microscope. Is that right? And very importantly, it's very important that if person dies, if a person organism dies much earlier, then the tissue will not show necrotic changes. Let me give you a classical example. Let's suppose we talk about myocardial infarction, and I will explain that what is the importance of timeline. Let's suppose here is your heart. I'm making a very simple diagram, right? And here is a blood vessel which is supplying this part of the heart, right? And this blood vessel is closed. Let's suppose that here is atherosclerotic plaque, and this plaque suddenly is disrupted or a thrombus form on it, and this is closed. What will happen? Then on the dependent myocardium there will be severe ischemia or hypoxia. There will be severe deficiency of oxygen and other nutrients to the dependent myocardium. Let's suppose this is the dependent myocardium, right? This piece of myocardium is now, if severe deficiency of oxygen and nutrients remain more than 30 minutes, it is irreversibly injured. It is irreversibly injured. But if person dies, let's suppose if person dies within 1 hour, for example in sudden cardiac death, person dies within 1 hour of onset of these symptoms, and after the death, if you remove the heart and you try to look the area of necrosis, will you find morphological changes of necrosis? Answer is no. Very good. If person dies within 1 or 2 hours, for example in sudden cardiac death, after the onset of severe ischemia to a part of myocardium, right, necrotic changes will not be there. Let's suppose, I give an example. For our example, person dies after 3 hours of onset of severe chest pain. Now cause of death may be that this ischemic area precipitated ventricular tachycardia or ventricular fibrillation, right? Due to tachyarrhythmia, person dies. If this person dies, even though there has been severe injury, irreversible injury, lethal injury to these myocardial cells, but if after 2 hours or 3 hours you look under the microscope, these cells, they will not show necrotic changes because it takes many hours. Am I clear? Then in such person who had developed very severe myocardial ischemia, which is leading to myocardial severe dysfunction or precipitation of dangerous arrhythmias, and person dies earlier, you will not find necrotic changes or changes of necrosis. What you may find? You may find evidence of chronic atherosclerotic disease of coronary arteries, or you may find evidence of plaque disruption, atheromatous plaque disruption, or you may find some evidence of remote myocardial infarctions and their healed scars. Listen carefully again. What I'm trying to put in your mind, I'm trying to put that when severe or lethal injury occur, necrotic changes don't appear like this. They don't appear like this. They take long time. And during those hours, that injured tissue should remain the part of the living organism. If organism dies very early, then tissue was not alive for a long time to produce necrotic changes, morphological changes in the injured cells. Am I clear? What happens in these cases? If early death occurs, right, you may not find necrotic histological changes into myocardial cells, but as I told you, one of the hallmark of necrosis is plasma membrane, cell membrane disruption. Right? When myocardial cells are disrupted, intracellular cardiac specific enzymes and proteins may leak out from severely injured area because membranes of cells are disrupted. Those proteins and those enzymes which are cardiac specific, which are specially present in myocardial cells, because membranes are ruptured, they leak out into interstitium and drain through lymphatics and capillaries into the general circulation. Right? And such enzymes can be detected in the blood of the patient as early as 2 hours of the irreversible injury. For example, there can be cardiac specific troponin T or cardiac specific troponin I. Right? These are calcium binding proteins. Right? This is a special type of calcium binding proteins, right, which are present in myocardial cells. And when they are injured, they leak into blood. Or there is a creatinine kinase enzyme which is present in many tissues. One of its special type, which is called CKMB, myocardium bound, especially present in myocardium in higher concentration. So this will also leak into blood. So what will happen? That if someone suffers with severe injury, ischemic injury to the myocardial cells, lethal injury, irreversible injury, of course these cells start the process of necrosis, but it is going to take many hours. Is that right? And if you want to make a diagnosis, of course you make with the symptom of, what is this? Myocardial infarction. ECG also help. Plus you look for the biomarkers of myocardial infarction in the blood. Is that right? So if a patient with severe chest injury has in the blood troponins high concentration, CKMB high concentration, right, you know that irreversible damage has been done to the part of myocardial cells. But if these cells remain there and patient remain alive, what will happen? These cells will produce chemical mediators of inflammation. Around it, inflammatory reaction will occur. What will happen? Inflammatory reaction will occur, and from the inflammatory zone, neutrophils and first neutrophil will arrive there, and later on macrophages will arrive there. And what they will do, over the days, they will start digesting away the necrotic cells and start activating the localized fibroblast, converting localized fibrocytes, local fibrocytes, activating the fibrocytes, and activated fibrocytes are called fibroblasts. And those fibroblasts start producing collagen, and over some week, eventually this necrotic cells will disappear and collagen will be deposited in that area, right, and scar will be formed in the myocardium. Am I clear to everyone?
Yes.
Right? Done. Now, let's come back. Initially I told you I will keep on stressing morphological changes. It means, what are these morphological changes? Even though I told these morphological changes are due to denaturation of protein, it is due to enzymatic digestion, and it is also, there is an inflammatory reaction. But first we talk about single cell. Let's suppose we I will put one single cell and I will show you what changes occur into that cell, right? When it is irreversibly injured. Of course, changes can occur into cell membranes, changes can occur into cytoplasm, changes can occur into cytoplasmic organelles, and changes can occur into nuclear material. Is that right? Now, let's suppose this is our normal cell, right? And I will compare it with the necrotic cell. This is a normal cell. Let's suppose here it is having a nucleus, right? And you know, normally the cytoplasm takes which color? Eosinophilic, right? Cytoplasmic protein take eosinophilic color, right? Cytoplasmic proteins, right? They bind which stain? Eosin. Eosinophilic color is slightly pinkish. So what happened? And cytoplasm does have what? Ribosomes. But ribosomes take which color? Blue color. They bind ribosomes like nucleic acids. RNA does not bind the eosin, that binds hematoxylin, which gives a blue color. As plasma proteins are more and ribosomes are less, so there's more, normally there are more eosinophilia and less basophilia in the cytoplasm. Is that right? And of course, nucleus has a lot of DNA and it binds a lot of hematoxylin, so it is deeply which color? Basophilia. Basophilia means blue color. Hematoxylin, blue color. It binds with RNA, DNA classically, and eosin, pink color, reddish color, and because it binds with the plasma protein specific, cellular proteins. Am I clear? Now, and of course, there are organelles also. There is, let's suppose, mitochondria, and further detail I will not go. Now, when a cell is lethally injured, what happens to this cell? Here is the injury, right? Lethal injury. What will be the changes which will occur in the cell? Number one, protein denaturation process will start, right? These changes we can see under light microscope. When protein denaturation will start, just imagine this is protein, a folded protein, and it will open up. When it opens, it binds more stain. Is that right? When protein is tightly folded, it binds less eosin. And when they denature and open up at multiple points, eosin bind. So cell cytoplasm will become intensely eosinophilic. Cell which is having denatured proteins, unfolded proteins, they tend to bind more eosin. So cytoplasm become more intensely eosinophilic, more reddish. Is that right? And here is the cell. Now, nuclear changes I will talk later, right? They occur simultaneously, but I will talk later. Now what happened? Cell become more intensely eosinophilic. The question is that why cell becomes so intensely eosinophilic? There are two explanations. Number one, as proteins undergo denaturation, denatured protein bind more eosin, so it becomes more intensely red. Number two, you know ribosomes, they bind which color? Blue color, hematoxylin. They also undergo disintegration and ribosomes disappear during necrotic process. When they disappear, there is loss of basophilia, cytoplasmic basophilia. The loss of cytoplasmic basophilia due to disintegration of ribosome. So double reason why it becomes more pink. One reason, loss of blue coloration, which is little bit normally present, and number two, increased staining by the eosin. So these two reasons lead to eosinophilia. So what we can say, in a necrotic cell, a process passes by. Number one change which I told you, what is that? Cytoplasm become more eosinophilic. Clear? Then another thing. Over the time, of course I told you that there are what? Organelles there. They are different. Mitochondria or lysosomes and other. As time passes by, even these organelles, right, they are also digested away. When they will become digested away, what will happen to the cell? I will talk about nuclear changes later, right? I'm just talking about cytoplasmic changes. Now the cell will remain, what is this? Highly eosinophilic, right? And, okay, one more point before I talk about organelles, one more point I would love to mention, that is that cells have granules of glycogen as stored energy. What is this? Granules of glycogen. Actually, when cells undergo extreme stress, they convert glucose into pyruvic acid and lactic acid. So it is partial breakdown of glucose. So it is not energy efficient. Under this stress, cells very rapidly break down glycogen into glucose and consume it. So glycogen granules also disappear. If glycogen granules disappear, it means on staining, the granular appearance of cytoplasm will be lost and cell will become homogeneous, glassy. It will become homogeneous, glassy. So, number one change was increased eosinophilia in cytoplasm, right? Number two, due to loss of glycogen granules, what will happen? There is a cell become more homogeneous and glassy appearance. Glassy appearance of the cytoplasm, more homogeneous glassy appearance due to loss of granularity, which is normally imparted by glycogen granules, which are rapidly consumed. Third change, not only they become intensely pink and glassy cytoplasm, but at multiple points when these organelles are digested away, then these areas will look empty spaces. They will look as empty spaces. And these empty spaces, it looks as if some caterpillar moth has eaten the cell. So it gives moth-eaten appearance. Moth-eaten appearance. It is not mouth-eaten. That is somewhat, I think, romantic situation. It's moth. Moth is something like a caterpillar, right? Related with, what is that? Insects with two big broad. It's not butterfly. It's slightly different. Or maybe, I don't know. I'm not specialist in insects. But I know moth is something like insect with very big, broad wings too, right? So anyway, their caterpillar, it appears as if moth has eaten multiple points. Is that right? These are the cytoplasmic changes. I will repeat it. When cell is undergoing changes, number one, there is increased eosinophilia. Number two, there is glassy appearance, eosinophilia due to increased protein denaturation, binding more eosin, and loss of basophilia due to loss of ribosome. Glassy appearance as loss of granularity in the cell, which was produced by the glycogen, right? And thirdly, as organelles disappear, right, those areas look empty spaces as if they are moth-eaten appearance.
What is myelin figure, sir?
I'm going to tell you. After that, I will tell you what are myelin figures. Okay. So now, here you want to know what are myelin figures. Let me tell you. When most of the components are digested away, and cells, most of the components are digested away, then cell membranes may be left over there. When enzymes do proteolysis, proteinaceous substances digested away, then cell membranes or organelles membrane, let's suppose this is cell membrane, and organelles membranes, they are dumped, they are left at the site of necrosis. And usually they are like whorled, they look like this, whorled phospholipid masses. These are just crumpled membranes. These are called myelin figures. These are called myelin figures. These are called myelin figures. two things happen to these myelin figures. Either macrophages come and they eat up the phagocytose the myelin figures and they disappear. Or if they stay in the body for a very long time in the living organism, ideally what should happen, the macrophages which come, they should eat up the cellular debris and cellular component, and eventually they should eat up myelin figures also, which are more resistant to digestion, phospholipid membranes, whorled pieces of phospholipid membranes. But if they stay there and they have not been phagocytosed, then phospholipids are negatively charged. So they will attract the calcium. They will attract the calcium. So calcium will bind there. And when calcium will bind there, then this part of the cell will undergo dystrophic calcification. Watch me kar diya? Dystrophic calcification. The classical example is in tuberculosis patient. When there is caseous necrosis, caseous tissue stays in the body for longer time because macrophage cannot effectively remove it. So then caseous tissue, which has having lot of lipids, right? These caseous tissue may undergo calcifications. So in many situations, if necrotic cells persist in the body for longer time, right, then that will lead to what changes? Calcification of those cells, or calcification of remaining mitochondria, or calcifications of remaining myelin figures. Am I clear? Right? So these are light microscopic changes in a necrotic cell. Now we come to electron microscopic changes. That is called ultrastructural changes. Under the electron microscope, what changes you will find in these cells? Number one, plasma membrane ruptures. Right? Plasma membrane ruptures or discontinuities in the plasma membrane. Discontinuities in plasma membrane. And these ruptures are not only into cell plasma membrane, but also these ruptures under electron microscopic can be visible in organelles membrane. Right? Then not only plasma membrane rupture is there, of course, you will find under electron microscope that injured mitochondria swell up. Right? This is normal mitochondria. Right? And injured mitochondria become swollen. And with these mitochondria also may have dense amorphous bodies. Dense amorphous body. This is a feature of severe injury to mitochondria, that mitochondrial enzymes and structures clump. So what do you see under the electron microscope when cells are passing through necrotic changes? Of course, plasma membrane ruptures are there or discontinuities are there in the cell as well as intracellular organelles. Secondly, mitochondrial enlargement, swelling, and large amorphous densities present in the mitochondria. Large amorphous densities present in the mitochondria. With that, intracellular organelles, their membranes, they may be seen like small, what are these? Myelin figures. So small but multiple myelin figures within the necrotic cell. These are derived when different lysosomal or peroxisomes or Golgi apparatus or endoplasmic reticulum or mitochondria, all those membranous organelles undergo what? Changes, right? And they may end up with small intracellular multiple myelin figures. Is that right? Then within the cell, there may be, in the cytoplasm also, there may be some amorphous deposits, right? These may be denatured proteins. Amorphous fluffy material may be present in cytoplasm of a necrotic cell, which can be visualized by the electron microscope. What it is? It is necrotic. In the necrotic cell, it is denatured proteins. These are denatured proteins, right? So you can see under electron microscope, the changes which you will see, we call them ultra structural changes, and these changes may be ruptured membranes, swollen mitochondria with amorphous densities, multiple intracellular myelin figures, and fluffy amorphous deposits in the cytoplasm, which may be representing denatured proteins. Is that right? So these were the changes in the cells. Now we come to the changes in nucleus. That what happens to these nuclei of lethally injured cells, right? These nuclei can disappear because as proteins are being digested, in the same way enzymes may lead to digestion of nucleic acids. They may digest DNA, they digest RNA and other component of nucleus. So this nucleus also eventually disappear. But in different cells, it disappears by different style. Its disappearance is also stylish. Sometimes in some cells, suppose this is a nucleus, right? It gradually fades away. It gradually fades away and then disappear. This process where in necrotic cell, nucleus become less and less basophilic, because normally nucleus take which color? Basophilia. Gradually it becomes less and less basophilic and then it fades away. It fades away. Nucleus fades away. This is called karyolysis. What is it called? Karyolysis. So what is karyolysis? This appearance of necrotic cell nuclei by gradual digestion of its components and gradually fading away basophilic mass. In some other situations, nuclear components, they condense. Before they totally disappear, they condense. For example, this was normal nucleus, and with the time they become more condensed, and then they become super condensed, right? And if they become very much condensed, extremely basophilic clump and shrunken, if in this fashion nucleus is disappearing, we call it pycnosis. We call it pycnosis. Pycnosis, right? This was karyolysis and this is pycnosis. And third style in which nucleus may disappear, that is nucleus simply undergoes first of all condensation and then it undergoes fragmentation. This undergoes fragmentation and then disappear. Like how nucleus undergoes blast. It is not nuclear blast, by the way, right? So this is called karyorhexis. Karyorhexis. This is karyorhexis. So again I will repeat, as there are changes into cytoplasm which can be manifested by light microscopy or by electron microscopy, and there are changes in nuclei, right? Nuclear cytoplasmic changes under the light microscope increase eosinophilia, glassiness, moth-eaten appearance, and myelin figures are left, which may be either totally phagocytosed or if they stay longer they will become calcified. Electron microscopic changes, yes, plasma membrane disrupted or ruptured, mitochondria swollen with amorphous densities and intracellular myelin figures and with amorphous fluffy denatured proteins, right? How the nuclei undergo morphological changes? The morphological changes in the nuclei of necrotic cells, either they gradually fade away, that is karyolysis, or they become intensely basophilic and condense and clumped mass of basophilic material, that is pycnosis, or they slightly condense and then fragment, that is called karyorhexis. Right. Now we will go to the different types of necrosis, right? First, few words about coagulative necrosis. Now, what is coagulative necrosis? Coagulative necrosis is a type of necrosis in which a group of cells, when they are lethally injured, their structural and functional proteins undergo denaturation simultaneously. How? Classical example of this is again myocardial infarction, right? That let's suppose this is a piece of left ventricle, right? And there's a blood vessel here and which closes, right? There's a plaque, and with that atheromatous plaque with thrombus. Now, the cells which are over here, they will undergo coagulative necrosis. Now, what is coagulative necrosis? The special hallmark of coagulative necrosis is that necrotic cells maintain their basic architecture and outlines at least for a few days. After the lethal injury has been done to these cells, during the process of necrosis, the necrotic cell maintain their cellular architecture and cells outlines at least for few days. Why it happens so? The reason is, as I told you, that in necrosis there are three components which occur. Number one, I told you that there is denaturation of proteins, right? Number two, I told you that there is enzymatic digestion, and number three, I told you that there is surrounding inflammatory reaction. Reaction. Now let me explain what happens in coagulative necrosis. As I told you in the beginning that there are two types of categories of proteins. There are structural proteins and there are functional proteins, and out of functional proteins there are enzymes as well. Right. Now you imagine that if there is severe ischemia or hypoxia here, right, and denaturation of proteins starts, if structural proteins and enzymes both undergo denaturation simultaneously, listen, as soon as there is very severe hypoxia to cells, right, what will happen? That in the cells very rapidly ATP levels will go down, right, and lactic acid levels will go up, and protein will start undergoing denaturation. If denaturation process is so severe and so broad spectrum that not only structural proteins undergo denaturation but simultaneously enzymes also undergo denaturation. If enzymes are denatured, it means they are non-functional, and if they are not functioning, can enzymatic digestion start there? No. A very big no. No. So what will happen? Cells will be frozen. Apparently cells will be frozen. That, now look here, this cell, this is a group of cells, and these group of cells will be undergoing changes, but enzymatic digestion or proteolysis is arrested. Proteolysis is arrested as enzymes are denatured. Or digestion is delayed until the leukocyte come and they bring their enzymes. So it means there is no autolysis. Their own lysosomal enzymes or their peroxisomes or other degradation systems, they are frozen themselves. Then what will happen? That as digestive process, enzymatic digestion is delayed at least for few initial days, cells structures will be well maintained, right? And gradually cells will become highly eosinophilic, and as you know, as I mentioned in previous lecture, that nuclei will disappear. So very soon these necrotic cells will appear as if they are highly eosinophilic anucleated cells. Highly eosinophilic cells without nuclei. Is that right? But opposite to that, if we make a concept that structural proteins undergo denaturation, but functional proteins remain active, enzymes remain active, and if enzymes are very intensely active, they will lead to liquefaction of this tissue. They will digest away this tissue. But in coagulative process, there is no digestion at least initially. Is that right? Is it clear? So, classical example of coagulative necrosis is myocardial infarction or any severe ischemic injury or hypoxic injury to most of the tissues of the body. Severe hypoxia or ischemia to part of a liver or part of a kidney or part of a spleen, right? It may undergo coagulative necrosis, right? What is the hallmark of coagulative necrosis? Again, it is such kind of necrosis in which not only structural proteins undergo denaturation, but enzymes also undergo denaturation almost simultaneously, right? So cells structure is denatured and enzymatic processes, digestion is not started, right? Due to that reason, as there is no autolysis, cells become deeply eosinophilic, and over 1 or 2 days nuclei disappear, but still cells maintain their structural architecture or cells maintain their outlines. Is that right? But as time passes by, eventually when cell membranes are ruptured, what happens? Inflammatory reactions start around this focus of necrosis, and that inflammatory reaction will bring what? What are these cells? Neutrophils. So eventually inflammatory reactions start around these cells and neutrophils appear there, right? And they start digesting these cells. But this digestion by neutrophil, lysosomal, this is not autolysis, this is heterolysis. And of course, as time will pass by, the second line of white blood cells will arrive there, and that is what? What are these? Macrophages. And then macrophages will also come over here. So neutrophil and macrophages will make an inflammatory zone around this coagulated necrotic material, right? And before it could really get completely digested, before it could become completely digested and removed by neutrophils and macrophages, local fibrocytes are converted into fibroblasts, and they migrate into this area, these fibroblasts, and they lay down what? Collagen, right? And gradually these cells are eaten up by neutrophils and macrophages, and then as they disappear, right, these fibroblasts have deposited their collagen and scar is formed over there. So this is what happens during coagulative necrosis. This is what happens during coagulative necrosis, that before the tissue undergo extensive digestion, actually cells have been removed and leukocytes and fibroblasts initiate the repair process. Am I clear? Any question up to this? Right? So this was about, again, very severe ischemia or hypoxia to most tissues of the body produces coagulative necrosis, but there is one exception. That is your brain, your central nervous system. If there is brain infarction, cerebral infarction, or brain stem infarction, unexpectedly, that does not undergo coagulative necrosis, that undergoes liquefactive necrosis. It means if there is severe ischemia to part of the brain, right, dependent, if this vessel is blocked, dependent cells will undergo liquefaction. What I mean by that, these infarcted cells will undergo, cerebral infarction cells will undergo liquefaction, mean they will convert into a creamy viscous material. What I mean that cellular outlines will not be maintained. Why it happens? No one is sure why it happens. But there are different speculations. Few authorities believe it is because in the brain, in central nervous system, structural architecture is not so strong. Structural proteins are not in massive amount. Other authorities say that in lysosomal enzymes, are slightly different in central nervous system and they are more abundant. So they cannot be completely frozen and they digest away the tissue. Still other authorities believe that liquefactive necrosis may be because in central nervous system, of course, lipids are more. Right? So all these things are put forward, but one thing is very important, that severe ischemia or hypoxia to almost all tissues of the body produces coagulative necrosis. Is that right? A localized area of coagulative necrosis is called infarct. Localized area of coagulative necrosis is called infarct. Right? The only exception is central nervous system, where severe hypoxic injury or ischemic injury lead to liquefactive necrosis. We are not very sure why it happens, why in central nervous system, when structural proteins undergo denaturation, why enzymes remain active and it gets liquefied. Some authorities believe there are different speculations. There are 3 different reasons are brought forward, again, but none of them is very authentic. One is probably in central nervous system, structural proteins are less than the other solid organs. Secondly, in central nervous system, lysosomal enzymes are slightly more intense. Thirdly, in central nervous system, phospholipids are more due to so many membranes of the neurons. Am I clear?
Yes.
Okay. Now let's compare coagulative necrosis with liquefactive necrosis. What happens in liquefactive necrosis? Liquefactive necrosis is a type of necrosis where even though structural proteins undergo denaturation, but there is intense enzymatic digestion. It's very simple. Here, structural proteins in coagulative necrosis, structural proteins undergo denaturation as well as functional enzymes also. So autolysis doesn't occur, at least initially, right? But here, liquefactive necrosis is a situation in which when an area of an organ or tissue undergoes severe necrosis, even though structural proteins are denatured, but enzymatic digestion is intensely going on into that tissue and severe proteolysis occur and component of those cells convert into liquid material, right? What could be the example? First of all, we should remember this thing. Liquefactive necrosis is where structural proteins may undergo denaturation, but there is intense enzymatic digestion, and this enzymatic digestion may occur due to autolysis. It may be due to heterolysis. Heterolysis. Because the areas where there is liquefactive necrosis, usually there are a lot of leukocytes there. And leukocytes in very massive number, releasing a lot of lysosomal enzymes which are trying to digest everything around. Is that right? Lot of. And with that, so it means heterolysis may be due to enzymes derived from leukocytes, or in these areas there may be a pyogenic organism which produces pus, right? Like E. coli or streptococcus, and they themselves also produce dangerous digestive enzymes. Plus, these pyogenic organisms not only themselves produce digestive enzymes, these organisms also give strong signal to accumulate neutrophils, and neutrophils produce also digestive enzymes. So leukocytes plus there are enzymes which are derived from microbes, right? Pyogenic microbes. Usually it's a focal bacterial infection or sometimes even fungal. So liquefactive necrosis is classically seen in pyogenic inflammations, right? Pus forming inflammation, pyogenic organism. Is that right? Like streptococcus, staphylococcal, E. coli, Klebsiella, salmon, organisms like this which produce pus in the organs or tissues. Now, why tissue undergo liquefaction? It is very clear. Intense enzymatic digestion. And here it is important because digestive process is very fast at the focus of injury. So we can say that in liquefactive necrosis, tissue dissolution is faster than the repair process. Tissue dissolution by the enzymatic process is faster than the surrounding repair process. Here tissue dissolution is, necrotic tissue dissolution is slower than the repair process. Am I clear?
Yes.
Right. Now, classical example of liquefactive necrosis should be pus. Now what is pus? Everyone knows what is pus, but let me make a little concept that when we say in one part of a body, in a tissue or in an organ or in a confined place in the body, there is pus formation, what we really mean medically. What really happens, let's suppose this is a tissue, okay, I will give you an example of liver, right? And if some pyogenic organism come here, I will bring this area out. Okay, these are the microbes, very dangerous microbes, which are very toxic, producing dangerous destructive enzymes into the tissue and producing severe inflammation. Is that right? Now, in the area, when these dangerous microbes come or bacteria come, of course, they will bring their what? They will damage the local cells. Let me make local cells red. So local cells are also there. Is that right? And these are the bacteria infiltrating this tissue, and there are local cells, I will call them parenchymal cells. And when the bacteria are damaging the cells, then damaged cells, injured cells and bacteria, both of them attract the neutrophils. If there is intense neutrophil infiltration, why in source of inflammation usually neutrophils arrives earlier than the macrophages? Who will tell me? Why neutrophils arrive usually at the site of acute inflammation? Neutrophils arrive first and macrophages arrive later. Why? Multiple reasons. Not smaller size, my friend. Multiple reasons. Number one, the chemotactic agent from the source focus of injury. The chemotactic agent which attract the neutrophils, they are produced initially. And chemotactic agent or chemical mediators which attract the macrophages, they are monocytes. When they come out of the blood vessel, they become macrophage. They are produced later. Secondly, of course, neutrophils are more abundant than the monocytes, and neutrophils are more mobile than the monocytes. It's just like war zone. In the war zone, the army jeep will come first or tanks will come first? Tanks are slow to come. The army jeeps will come first. So neutrophils are like jeeps. In body defense, neutrophils are more abundant. So jeeps are more abundant. They are more faster than the tanks, macrophages. They are more abundant, they are more fast, and call is given first to them. Chemotactic agent or chemical mediator. So if next time someone asks you why neutrophil usually arrive first at the scene of acute inflammation, right, and later on macrophages come, you will say like jeep. You know jeeps? Like jeep. Neutrophils are more abundant. In any army, jeeps should be more than the tanks. So neutrophils are more abundant, more mobile, and call is given to them, chemical signals are given to them earlier. But once neutrophil come here and start fighting, and if they feel the fight is really tough, then they give signal to the tanks. They give chemical signal to the monocyte macrophages. So that is why macrophage come later. The multiple reasons. Macrophages are slow to extravasate. They come out of blood vessels at the focus of injury slowly. They are less in number, right? And then they are called also later on. So first wave of leukocyte which come is neutrophil. Second wave of leukocyte which come is macrophages. Where are macrophages? I didn't show here. Okay, I will show the tanks here. These are the macrophages. Right? These are macrophages. And another thing, initially when tissue is inflamed, it is rich in neutrophil. If injury continues for longer time, gradually this area becomes poor in neutrophil and abundant in macrophages. What are the reasons? One mechanism I already explained. The initial injury, within few hours, neutrophil should be more and macrophage should be less. I told you basic mechanism that neutrophil come faster, they are abundant, and they come and they are more mobile. Macrophage are late to come and slow to come. But another reason, as days go by, this area becomes very rich in macrophages. Why? Because neutrophil life is very short. Once the neutrophil come into the war zone, they die within few hours. Macrophage can live for weeks. So tanks are slow to come, but once they come, they are there. But neutrophils are blasted away during the fight with. Even let me tell you one more thing. If even macrophages become very frustrated, then they give a call to the lymphocytes. They call lymphocytes. But anyway, we will not go into that detail. What I tell you, in the process of formation of pus, what really happens, there is acute inflammation, severe injury, usually by, for example, pyogenic organisms, right? And these organisms produce severe damage to the local cells. Is that right? Yes. And they then injured cells and pyogenic organism, they call neutrophils. And very soon there is a very big aggregate of, what is there? Highly dangerous microbe and leukocyte and injured cells. Now all of these are producing dangerous enzymes. Leukocyte, first, very dangerous enzymes are, proteolytic enzymes are produced by this microbe. Number two, when cells are ruptured, their lysosome produce dangerous enzymes. Then neutrophil come, they also produce destructive enzymes. So this area becomes very rich in destructive enzymes. Due to that reason, so much enzymatic activity goes on here that tissue undergo liquefaction. That injured cell, necrotic cell, cannot maintain their outlines, structural outlines, even for short time. Is that right? And we say, of course, there is inflammatory reaction here, blood vessels are dilated and microcirculation is leaky and protein-rich fluid is coming into this area. Now, eventually all this area becomes yellow creamy color and we call this pus. But what is pus exactly? Let me tell you. In this area, when such a hot war is going, big war is going on, what will be there? Number one, there will be local cells. There will be local cells. Now these local cells or parenchymal cells, some of them will be alive in the area of pus, some of them will be alive, some of them will be dying, and some of them will be already dead. It means in the pus, for example in the liver pus, there should be hepatocyte. Is that right? If pus is in the brain, there should be alive, dead or dying neurons. Is that right? Depending upon the tissue. So wherever there is pus is being formed, what is there? Alive, dead and dying. Alive,
dead and dying.
And dead and dying local cells, the parenchymal cells. Plus, of course, microbes are also being attacked by the neutrophils. So, some microbes are happy and some of them are suffering. So there will be alive, yes, dead and dying, what? Microbes. Thirdly, leukocytes, when they are jumping into fight and leukocytes are fighting, white blood cells, especially neutrophils are fighting there, some of them, the neutrophils in that area will be alive, some of them will be dead, or some of them will be dying. So it is just like a war zone. Pus is an area of war zone, and in that war zone, what happens? There are some cells which are alive, some are injured, dying, and some are already dead bodies. So what is pus? Let's make it further. And because of intense inflammation, there is increased blood flow in that area and increased permeability from the microcirculation. Protein-rich exudate is coming out. Protein-rich exudate is coming out. So what we can say there? that pus is an area of liquefactive necrosis. Pus is an area of liquefactive necrosis. It consists of alive, dead and dying local cells, alive, dead and dying microbes, alive, dead and dying neutrophils, all floating into protein-rich inflammatory exudate. All present in protein-rich inflammatory exudate. That is pus. So now onward, someone asked you what is pus? Pus is an area of liquefactive necrosis. And in the pus, what is their composition of pus? It's a protein-rich exudate having lot of alive, dead and dying local cells, alive, dead and dying microbes, alive, dead and dying neutrophils. Am I clear?
Yes.
Now, another example of liquefactive necrosis is abscess. What is the abscess? Now it's easy to understand. Abscess is actually localized pus, which is in any deep tissue. When a pus becomes localized in one area, let's suppose in the liver here is pus. Now if the pus is here, right, it is localized from all sides, then we say this is abscess. So what is abscess? A pocket of pus, or pus which is localized in a deep tissue or organ or in a confined space in the body. For example, in peritoneum there is maybe pocket of pus, or in the pleura some area pocket of pus, right? Then we call it abscess if it is localized. Is that right? Now if you look at the abscess, right, what you really find, actually let me tell you abscess here. First of all, in the center of the abscess there will be a lot of dead neutrophils and dead microbes and dead local cells. It's clear? Around it there will be active neutrophils, because neutrophils are coming from the surrounding area. So dead bodies are center, and around that fight is going on. So we say in the abscess, in the heart of the abscess, in the central core of the abscess, what is there? Dead neutrophil along with dead cells and microbes. Around it there are a zone of preserved neutrophils or fully active neutrophils. Around that there is area of dilated blood vessels due to inflammatory reaction. Is that right? And of course around this area, if abscess remain for a long time here, then there is an attempt of the tissue to repair. So local cell, let's suppose these are hepatocytes. Hepatocytes are trying to multiply around it, because whenever there is inflammation and injury, growth factors are also produced for the repair. Is that right? Even fibroblasts are also active there, and they are trying to make some fibro. So what is happening actually? That at the outer margin zone of the abscess, local cells are trying to proliferate so that they can compensate for the dead cells. Plus, lot of fibrotic reaction is going on, fibroblast, so that they try to wall off the abscess, localize this area. And even if it remains for their long time, it cannot heal. Usually we need to drain the abscess, because it is walled off and then it remains a focus of infection there. So what is abscess? Another example of liquefactive necrosis, right? But remember, liquefactive necrosis can be without pyogenic organism. Classical example is central nervous system, in which simply ischemia or hypoxia can produce liquefactive necrosis, right? That was an unusual situation. But abscess is well localized, pus in a deep organ or tissue or in a confined space where there has been seeding of pyogenic organism. Abscess consists of a central zone of dead neutrophil along with dead microbe or local cells, surrounded by a zone of highly active neutrophils, and around that there is a dilated blood vessel sphere inflammatory reaction like blood vessels and parenchymal cell repair effort, parenchymal cells and fibroblast laying down a lot of collagen, right? Any question up to this? We'll discuss about remaining type of necrosis like fibrinoid necrosis, caseous necrosis, or yes, gangrenous necrosis and other type of necrosis. We will fat necrosis. We'll talk in the next lecture. Okay, class dismissed.